Welcome everyone. This is Patricia from the International Hospital Federation. Thank you for joining us today in our first webinar this year, Investment Strategy, Dubai Healthcare Sector 2017 to 2020. This webinar is being presented by Dr. Ibtisam Al-Bastaki, Director of the Investment and Partnership Department at the Dubai Health Authority. Dr. Ibtisam Al-Bastaki is responsible for the development of various health public and private projects within Dubai. She also leads, advises, and guides on the best practices to ensure a proper holistic expansion in healthcare industries within the UAE. She has a wealth of expertise in both private and public sector, as at the Prime Minister Office, VPS Healthcare, Ministry of Health, and the Dubai Health Authority. She graduated as a medical physician from the Royal College of Surgeons in Ireland, gained her Arab board in family medicine, and secured her master's in healthcare management from RCSI. Moreover, she completed the Sheikh Mohammed bin Rashid Leadership Program. She is a scientific chair for international family medicine and head of the jury committee for special needs for Her Royal Highness Princess Haya since June 2014. She was awarded the Dubai Government Excellence Award for a shared project called ORAT in 2011, the Dubai Government Excellence Award for Distinguished Employee in 2010, and the Sheikh Rashid Award for Scientific Outstanding in 2008. Ibtisam, welcome and thank you very much for joining us today. Now, just to share with our attendees, you also presented this strategy during the World Hospital Congress in Brisbane last October. So we're glad that you can take the time to share it with those who weren't able to attend this session. Welcome again, Ibtisam.
Thank you, Patricia. Thanks for the introductions. I would like to start my presentation before these slides with a small video to give an overall about Dubai, and especially in public-private sectors, and from the investment healthcare perspective. So I will start with a small video. It is less than a minute, and then we will take you over the presentation. So I think you have seen from the video, to give you a little bit the background of Dubai, which is within United Arab Emirates. And Dubai has a different flavor in terms of the private healthcare sector as well as the government sector. So we all know that as a city, Dubai has more than 198 nationalities, with almost like 16 million tourists. They came over to Dubai in 2017. Majority of the population which are existing in Dubai between the residents and the nationals are between age of 15 and 64. So we're quite young population in the city. And of course, it's considered to be as a hub because we do have a quite a friendly destination, and we consider to be as a #1 city of quality of living across the Middle East and Africa for the past 5 years in a row. And as a city, Dubai, with the, of course, logistics and trade and airport and transport, is one of the best in terms of the gateway among the MENA region. So if you come to the healthcare sectors, in Dubai, we do have three different regulatory body, but majorities are taken care by the Dubai Health Authorities. There are few hospitals are licensed by Dubai City Authority, and that's basically a free zones area. And there are a couple of hospitals run within the Ministry of Health and Preventions. If you come towards the outpatient and inpatients, the growth rate is almost between 5 to 6% respectively between the public and the private sectors, and therefore as well as the inpatients, there is a shift from the public sector to the private sector, where they are taking over on certain specialities. Similarly, when it comes to the hospitals and facilities and professionals, there is a growth and increase in all these areas, which are showing there is a positive or excitement, as well as the appetite in the private market for the investors to come to Dubai and look at the different area and facilities. And as we know, the expenditures in Dubai has risen up about 12% per annum from 2012 to 2017. It used to be 9.9 billion, and it has reached to 17.5 billion. And that's the reason of the growth of population, as well as the chronic disease availabilities, as well as the technology and innovation was taking a lot of place in this area. And of course, our GDP is about 3.6%, which is quite higher than the GCC. However, we want to improve that kind of GDP by encouraging more investors to come and to look at the gaps and opportunities within the market. Of course, I'm heading the Department of Investment and Private Partnership in Dubai, and we are quite young department. However, our mandate's been approved by His Highness the Crown Prince Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum, and regarding our strategy of our investment and the partnership. And out of this investment, we have 6 major initiatives, which we have focused some of them in 2019, and some of them will be implemented within 2019-20. For instance, we have done with our investment guide. We looked on our investment governance as well as the incentives. And this year we are working on certificate of needs and how we bundle that with the commercial incentives. And we are working closely at a certain area in building policies with our regulation and funding to make more sustainable environment for the investors, as well as for the current players within Dubai market. So therefore, we are trying to inform those investors. We're trying to educate them. We're aligning all the investment priorities and promoting Dubai as a hub for the healthcare investment. Of course, we want to establish a really sustainable ecosystem market. Therefore, our focus on the first 2 to 3 years on certain specialities, for instance, innovation in primary health care, urgent care, emergency care, as well as the managing of chronic disease, long-term rehabilitations. And we will look on different specialty for the next 3 to 5 years, such as prevention and pharmacy beyond the pill, precision medicine, and nursing homes and palliative care. Of course, as we know, the demand for health services in Dubai is supported by population growth and health and high prevalence of the chronic disease. And of course, there is a mandatory health insurance within UAE, and that will support a good environment for the healthcare and to bring more innovations and flavor to the health tourism, to improve the climate of healthcare in Dubai. If you look at this diagram, the Dubai population projection, and especially if you concentrate on the baseline, there is an increase and growth up to 4.6 million by 2030. And that's in growth, promising at the certain area in Dubai, as what we have done during our capacity planning study. And we have forecasted in different areas of Dubai, especially like South Dubai and others, where we're going to have a more growth in number of populations. And here we did a lot of work around the gap analysis, comparing between outpatients and inpatients. There are certain specialities we would like to focus on. The red ones are the one which is under supply, and the green ones, that means there is a sufficient number in the market when it comes to the outpatient. However, if you look at the inpatient, there is a lot of areas needs to be developed in terms of the healthcare services, such as renal, urology, neonatology, pediatric, obstetric, psychiatry, especially mental health, some small version in cardiovasculars as well. And there is some changes happening to improve the regulatory body within Dubai Health Authority, and especially if you look at the some upcoming projects such as Sharian, which is a new transformation initiative to redesign the health regulation sector's licensing and inspection system, and that of course will improve the customer and employee experience, and as well as the operational performance and regulatory compliance. In terms of the insurance and the funding, we're looking at the DRG system, as well as we're looking at the IJADA, which is Dubai Health Insurance Performance Monitoring System. And this is to ensure that we have a good improved clinical results and enhanced patient experience. So therefore, the payment is not to pay per service, however, to pay per the outcome of the clinical. And this initiative as well, one of the initiatives which came out of our strategy, which is the investment guide. There is a lot of information regarding the mapping process in terms of licensing, whether it's for the new facilities or for the professionals, and it will explain to any new investor who would like to come into Dubai what are the process they need to follow up, and what are the steps they need to apply for and to go through it. And of course, as being in Dubai, you have a free zones area like Dubai Healthcare City and Dubai Science Park that are complementing to the healthcare as well, and that's to give a more sustainable and several advantage to the city as well. And topping up and adding to that, we do have the Dubai Future Accelerator, and this is a really promising for the startups company to accelerate them towards the DHA's access in terms of any innovation and technologies. And of course, we do have a health tourism department within Dubai Health Regulatory sector, and that's to give an overall and create a quite vibrant and positive environment and encourage health tourism in Dubai at a certain area. So if it comes to the PPP, we as a Department of Investment, we are working on a couple of PPP promising projects. One of them is the Cardiology Center of Excellence. And this Cardiology Center of Excellence is a PPP project where the operator will come in and invest in such a facilities. We are actually shutting down some of the government facility and transferring it to the PPP concept. And this PPP will attract so many of a strong operator, as well as the construction company, as well as the financial investors. And that's it. That's basically regarding my presentation, and the floor is open for any kind of question.
Thank you, Ibtisam. So we'll start reading some questions from the audience shortly. Just to remind everyone, you can send your questions by typing them in the Q&A tab. So a few questions here. What are the main drivers for healthcare investment in Dubai?
So as we know, and as I explained earlier, that the main driver for the investment in the healthcare in Dubai, first of all, rising aging populations. We are a young city and young population in Dubai. However, we are considering that the population will age in 2030 and onwards, and therefore that will increase the prevalence and risk factors of the chronic disease. And of course, changing in technology and new innovations in the delivery of the care, those are the main drivers for the investment in healthcare in Dubai.
Thank you, Ibtisam. So what was the thinking which led to the development of the new investment strategy?
Of course, as our Highness Sheikh Mohammed bin Rashid Al Maktoum, he is the Prime Minister and ruler of Dubai, and he's a very visionary person. And he always used to say Dubai is a business capital, focusing and supporting for any open and active private sector's engagement to improve the competitiveness as well as the supporting investment in terms of those kind of like a business in healthcare. We have submitted our strategy of the investment and private partnership to the top leadership, and we got an approval in terms how we can make it more adaptable with a positive vibe as well as a promising environment to sustain those private sector within our market. And therefore our roles came, and I explained earlier in my slide that based on that we came up with a major 6 initiative of the investment strategy, which we have worked some of them in 2018, and some of them we're going to work on it on 2019 and 20, and we will of course observe the whole results and how basically we can make it even in a better way.
Thank you, Ibtisam. Another question, what are the main benefits that can be showcased to potential investors?
We did a lot of work around the capacity planning for Dubai until 2030. So based on that, we have already identified our gaps and opportunity. We have looked at the different areas of specialities from outpatient and inpatient perspective, from the oversupply and undersupply. And therefore, these are the areas where the private sectors can come in and invest in Dubai. Of course, we will support this with our certificate of need. Certificate of needs, basically, we will work closely with our regulatory body. We will encourage and bundle it with incentives for the area and speciality which is not existing in the market of Dubai, where the demand and the need is there. So these are basically kind of a potential future where the future investor can look at it. And of course, as I mentioned, one of them is the cardiology, which is a PPP project. We're looking at the various different PPP projects, not only a pure PPP where you are looking from the operator perspective, as well as the operator and management, consultants, joint ventures, and others kind of contracts, where can attract a lot of different investors towards the market.
Thank you, Ibtisam. So one question, how was the health insurance pool built, and what's the strategy for ensuring private individuals donate to the pool?
Okay, we do have a funding department which is looking after the whole insurance market in Dubai. A majority of the insurance in Dubai is covered by the private insurance. There are certain insurance covered by the Dubai government for the citizens and for the employee of the Dubai government. And that's basically about 35%. The 60-65% run by the private insurance through some of them are real insurance, healthcare insurance, some of them through the third-party TPAs. In Dubai, 98 to 99% of all individuals are insured. So you can't get your visa if you don't have your health insurance. So it's a kind of a mandate. So there is a very small percentage is out of pocket regarding some specialities which is not being covered by insurance, for instance, like plastic and cosmetic.
Thank you, Ibtisam. Another question, can you please expand on the notion of home-based care in Dubai and what opportunities arise from this focus area?
Yes, of course, our market it's in a hunger for the home care, and our DHA, especially the funding team, regulatory team, and as well as the corporate team, they're working together, including us from the investment perspective. We are building a policy this year in terms of nursing home care, and there's another sectors in Dubai, which is the social sector. They're looking on the caregiver, basic caregiver. So there is a great appetite through the nursing home care. Although we are a young market and not yet an aging population, however, we are seeing and there will be a huge gap in the market in 5 years' time for the nursing home and home care.
Thank you. One question, are occupancy statistics for existing hospitals, both public and private, available to potential investors? And if so, where would one obtain those statistics?
Yes, these statistics you can find in DHA's website. You can see the occupancies rate across the whole across Dubai, I mean, and we are updating it soon from our strategy team regarding the capacity planning, where you can even have a look at the occupancy rate. If you want to have an access to the gaps and opportunities, you just enter Dubai Health Authority's website, and you will find an investment guide on the website, and which will give you a lot of informations.
Thank you, Ibtisam. Another question is, what specialties do you consider the highest grossing in Dubai?
Of course, primary healthcare, because we have a different segments in terms of populations. We do have a laborer class, and there is a gap there. We have as well as the middle class and the citizens, and we have the nationals as well. Primary care is one of them. I would call it more innovative kind of primary healthcare, including telemedicine into it, and especially from the chartered of His Highness Sheikh Mohammed bin Rashid, he mentioned, and it's a mandate on us, we need to work on it very closely, that each citizen, an individual, should have a doctor. So that's mean, you know, there is a real great appetite of the telemedicines and primary healthcare. The other thing is urgent care, and it's a very important in the market. Nursing home care will be a great appetite, and rehabilitation, of course, because that's all will because of the prevalence of disease that we have. And as you know, number one, mortality rate is due to the cardiovascular disease. Number two is oncology. Number three is road traffic accident.
Thank you, Ibtisam. So everyone, you can still send in questions. We still have time to answer more questions from the audience. One question here is, what are the main challenges, or what were the main challenges and key learnings throughout your implementation of the strategy in the past 2 years?
Of course, working at the high levels and cascading down to all the levels in the healthcare. Healthcare is a challenging area. It's not a straightforward area. It has a lot of complexities and specialities. And the major challenges we are facing is the culture change, especially if we do have a great market share by the private sectors, and and now you want to bring even that private sectors, because if you go, let me go 10 years back. The market share was the other way around. The government used to be the pioneer in giving the services from outpatient and inpatients. However, now with a strong regulation and maturity in the market, having a mandate of the health insurance, as well as the a proper planning in terms of the strategy perspective, this is all have shifted the market, and of course the vision of His Highness have shifted the market from the public to the private sectors. The key challenges is now how we can monitor those delivery of the services and keep it to the highest efficient and effectiveness from the clinical perspective as well as the financial perspective.
There's one question regarding telemedicine. Are there current regulatory hurdles a consulting doctor not based in Dubai may face? For example, a teleconsultation over Skype with a doctor in another country and the patient in Dubai.
It's a very good question, very valid. We have discussed this yesterday because we had a workshop around telemedicine. So far, we are not licensing anyone outside UAE because it's quite a new idea brought up to the market. And we have almost 3 to 4 companies are existing and licensed in Dubai, which we are working with them closely. We can't do now overseas yet because the compatibility in terms of licensing and regulation is need a lot of work to be done. However, anyone who is existing in the market or who would like to come to the market, yes, we are supporting them and we are working closely. We're starting with a different segment of population in the market, and then we make it as a standard and mandate across the city.
Thank you, Ibtisam. So while we wait, if there will be additional questions, perhaps you can say a few words about the presentation that, or the experience that you had when you presented the strategy at the World Hospital Congress in Brisbane last October.
It was a really great experience I had, especially our session was quite interactive because the question is, I mean, they had even various different questions like, are we still going for subspecialized services or are we still going for the general hospitals? And that all will depend on the demographies of the populations and how mature is the market. The other thing is it was a really great experience because of interaction among the globe. The people were participated from different parts of the world. They had a different experience, and the private market is reaching to the maturity, and they are coming to the level where they're discussing in terms of the efficiency of the services, value-based healthcare, and so on, and how basically the public sectors would like to partner the private sectors, bringing the right PPP concepts. And I believe in my sessions in Brisbane was a great session because there were a strong operator who functioned the public hospitals from the private perspective, and what was the advantage and disadvantage and how we overcome all these challenges. So it was a very great session, of course, done by Marissa, and she did really good job, and I believe there was a positive feedback which made me to talk you know, in this webinar for today.
Thank you, Ibtisam. All right, so we have here a question. What are the steps to be followed if one comes up with an innovation PPP opportunity? So what is the first step to engage with DHA?
Okay, so any PPP concept, when it comes, we will be the responsible. If you go to the guide, you will find our emails. Just drop us your innovative ideas or kind of, you know, PPP concept that you have. We will look at it and we will respond to you accordingly. If there is any appetite or not, we will revert back to you.
Oh, all right. There's a follow-up question. What about confidentiality?
In terms of telehealth?
In relation to the question earlier about the PPP opportunities.
Yes, of course. If you just give us the idea, I mean, or the concept itself, we can sign with you an NDA if you would like to make it more confidential. And then we are a government sector. Definitely, it will be quite confidential.
Okay.
And we have our legal department to support you as well.
That's great. Okay, Chani, thank you for sending the question. We have here one more question from Derry. So health investment requires medical practitioners to make it work. So do current regulations allow for multiple models of doctor remuneration? For example, private practice, salary-based, employed by insurer or hospital, and so on.
Yes, for the primary healthcare or any specialized services in Dubai, you need to be licensed and regulated by our regulations, DHA. And for any person who would like to come and practice in Dubai, he needs to be assigned to one of those facilities. Either he can start up his own, or he should assign with those some of those players within our market. So then you can be licensed. And if you have any further question in terms of the licensing of those physicians, you can just enter DHA's website and look at the processes that you require.
Thank you, Ibtisam. So yeah, a lot of the information would be available or is currently available at the website of DHA. And if there are any specific information that you need or you have question, you can contact Ibtisam and her team. We have the details, Ibtisam's details on the screen right now. So I guess last call, if there are any additional questions, you can still send them in. Okay, so I guess there are no more questions. So before we proceed, Ibtisam, perhaps there are additional, information that you want to share to our attendees, or a few more words that you want to impart to not just attendees, but also the people who will be watching the recording of the webinar.
Sure. I mean, Dubai market is quite a promising market, and we do have some areas that we encourage the private investors to look at it, especially at the certain specialities, which is very clear in our investment guide. I would like to thank IHF for giving me even an opportunity to be with you all guys for today. And of course, my participations in Brisbane was great, and I had a really good experience and interaction with different people. And of course, if you required, or if you do have any questions regarding to the investment and PPP strategy and anything to do with the private market, please do send us. Our emails are there. If you have any question or queries, we will answer or we'll get back to you.
Thank you, Ibtisam, and thank you again to everyone who sent in their questions. Now, before we close our session, as Ibtisam mentioned, the investment strategy was presented at the World Hospital Congress in October last year, and it was during the session of IHF's investor-owned healthcare organization's special interest group. So in that session, they explored different perspectives of the investment process in healthcare, some challenges and key concerns. So to talk a bit about this special interest group, I'd like to bring in my colleague Marisa Hill-Lapetra, the IHF Knowledge Strategies Manager, to just say a few words.
Hello, everyone, and good morning or good afternoon as it applies. Let me first thank you, Patricia Mancias, for organizing and leading this webinar, and also to Dr. Albastaki for her very interesting presentation. On my side, I will just add a few words. I am the knowledge manager of the special interest groups of the IHF, one of them being the investor-owned healthcare organizations. So we name it the IOC. As it has already been said, the IHF is an international not-for-profit, non-governmental membership organization. whose members are mainly worldwide hospitals and healthcare organizations having a distinct relationship with the provision of healthcare, but also associated healthcare services providers, and of course, investors are part of them. The IHF acts as a platform for exchange of knowledge and strategic experience, as well as for opportunities for international collaborations with different actors in the health sectors. In this respect, the IOSIG seeks to serve as a platform for networking for all stakeholders engaged in investor-owned healthcare services. So we have been witnessing during the last decades an increasing demand for private healthcare services worldwide, and investor-owned healthcare organizations do play an important role in providing quality care to people. The IOC intends to be a unique international network for dialogue, collaboration, and benchmarking between these investor-owned healthcare organizations in order to promote best practices and also a stronger recognition field of their participation to public health needs. So to this end, the IHF has put in place a platform for several bullet points here. The first one is exploring strategic methods to improve funding and financing mechanisms for healthcare delivery services in private settings, while, of course, serving as the intermediary between the financial institutions and healthcare services providers. We're there also to promote best practices, acknowledging the key role of private healthcare organizations to cover public health needs and highlighting the specificities of operating in the healthcare market environment. Then envisioning the future of healthcare delivery through the production of knowledge, content production, catalogs, repositories, webinars like these ones. And then finally, identifying opportunities for globalization in healthcare service delivery. And this includes participation to congresses, forums, etc. Now, we understand there are very distinct problematics for high-income countries and for emerging countries, obviously. And it is the group purpose to serve both. Now, within the healthcare demand for private health services in emerging countries, we realized the private health sector may offer very attractive returns to investors, but lack of information is dragging capital and isolating private healthcare facilities in these countries. So in this respect, the importance here is to enhance, as we're seeing it, is to enhance and nurture communications, and therefore the IHF holds, we think, the natural authority to represent the voice of the various stakeholders, namely the governmental instances, public authorities such as the DHA, the Dubai Health Authority, international financial institutions, and we include here the IFC, of course, investors and entrepreneurs on private healthcare. So now let me explain. Our current collaborative of the group focuses precisely on connecting these four stakeholders to identify needs and opportunities between investors and healthcare facilities. We had a very successful preliminary session in Brisbane during the World Hospital Congress in October 2018 with the participation of DHA, as well as investors from South Africa, EOH South Africa, entrepreneurs, Mediheal from Kenya, as well as one of the big players in the international scene, Ramsay Healthcare Australia. Out of this session, we concluded on the need to work towards a knowledge hub for the private healthcare industry, a kind of exchange platform for private healthcare entities with its own capital investment area, a framework outlining mechanisms for expansion and coverage of financial flows, identifying funding stakeholders, as it has been said, profiles and records, basically a kind of a forum for stating the unavailability of tools and resources. We're currently working now hand in hand with investors in a few African countries, investigating and cataloging common hurdles and challenges faced by them. And when going for green and brownfield investment, that's it. So cataloging the factors that impact the choice or differently, whether green or brownfield investments. Now, well, having said that, I wish I can raise awareness and I can spread the word and among investors, the investors community, and not only in emerging countries, of course. And I can only encourage all of them who actually find common avenues with us to join us. So this is all. Thank you for having allowed me to introduce our work. And anyway, anyone out there with a keen interest in private healthcare, please come and join us. Thank you and bye.
Thank you very much, Marissa. Thanks again to all the attendees. Ibtisam, thank you very much for this very informative webinar. It was a pleasure to work with you, and we're glad that we're able to present this to those people who weren't able to attend the session at the Congress, and then also there are additional information here. And as I've mentioned to the audience, the recording will also be available online after the following week. We'll send you the link so that you can watch it anytime when it's convenient for you. So thank you again to everyone who attended. We have a quick survey after the webinar. It would be great if you can just fill that out, just a few questions about the presentation today. So we hope you can join us again in our future webinars. Thanks again, everybody, and I hope you all have a great morning, afternoon, or evening ahead of you. Thank you, everyone, and goodbye.